Good afternoon, sir. My name is King Munhan, and I am a second-year medical student from the Cebu Institute of Medicine. So would you please state your name and your date of birth?
My name is Wesley Boone, and I was born in April 8, 1998.
So today I will be checking your abdomen, and I will be palpating for any tenderness, and this would involve me letting you take your shirt off. Would that be okay with you?
Yes.
Do you have any questions before we proceed?
Always remember to wash your hands before and after the physical exam.
Okay, sir. So how are you feeling? Are you feeling comfortable? So first, I will begin by inspecting your abdomen. I will try to look for any peculiarities in your abdomen.
First, observe the general appearance of the patient, lying quietly, writhing with discomfort, or gripping one side. From the right side of the bed, inspect the surface, contours, and movements of the abdomen. Watch for bulges or peristalsis. Try to sit or bend down so that you can view the abdomen tangentially.
So now I will begin by percussing your bladder. So tell me if there is any discomfort when I percuss your bladder.
I determine the height of the bladder by percussing for dullness. That is tympany. Now that's dullness. So the dullness is a little bit lower. Bladder volume must be 400 to 600 ml before dullness appears.
Now, sir, I will proceed by palpating your bladder. Is that okay with you?
Yes.
So please tell me if you feel any urge to void or to urinate, or if you feel any discomfort as I palpate.
Normally, the bladder is not palpable unless it is distended above the symphysis pubis. On palpation, the dome of the distended bladder feels smooth and round.
Do you feel any urge to void, sir?
Yes.
To determine if I was able to palpate the bladder above the symphysis pubis, I asked the patient if he felt any urge to void as I exerted pressure. No tenderness was noted.
Now, sir, I will then be palpating for your aorta. And please tell me if there's any discomfort as I palpate, since this will involve firm pressure on your abdomen.
Here, I try to look for the spot where I can first feel the aortic pulsations. I do the same from the right side. The distance between my fingers should not exceed 3 centimeters. If it exceeds that value, it might be a sign of an abdominal aortic aneurysm.
Do you feel any discomfort? Now I will be percussing your abdomen, and I will check for any changes in tympany and dullness. So again, the rules still apply. If you feel any discomfort, please tell me.
A protuberant abdomen with bulging flanks is suspicious for ascites, the most common complication of cirrhosis. Because ascitic fluid characteristically sinks with gravity, whereas gas-filled loops of bowel rise. Dullness appears in the dependent areas of the abdomen. So there you hear tympany. Again, tympany. There, tympany. So the patient's right flank is mostly dull. Now for the left flank. So there is still tympany. In order to confirm for the presence of ascites, I ask the patient to roll onto one side. I percuss and mark the borders again.
Okay, sir, so please lay on this side.
So there's still dullness in the patient's right flank. Now that was tympanitic. Dullness. And as I proceed to the midline, it becomes more tympanitic. In a person without ascites, the border between tympany and dullness usually stays relatively constant, such as in this patient. In ascites, however, dullness shifts to the more dependent side, whereas tympany shifts to the top.
Okay, sir, I will now test for any presence of fluid wave transmission in your abdomen. Since we do not have any assistant, may I ask you to please put your hand down the midline. And please press it firmly.
This
Very
pressure helps to stop the transmission wave through fat. As I tap one flank sharply with my fingertips, I try to feel for an impulse transmitted through the fluid on the opposite flank. Unfortunately, this sign is often negative until ascites is obvious, and it is sometimes positive in people without ascites. An easily palpable impulse suggests ascites. A positive fluid wave, shifting dullness, and peripheral edema makes the presence of ascites to 3 to 6 times more likely.
Sir, this part might be quite uncomfortable, so please tell me if you feel any pain as I try to ballot your liver.
To ballot an organ or mass in an ascitic abdomen, I straightened and stiffened the fingers of my hand together and placed them on the abdominal surface and made a brief jabbing movement directly toward the anticipated structure. This quick movement displaced the fluid so that my fingertips can briefly touch the surface of the structure through the abdominal wall.
Do you feel any discomfort, sir?
No.
I did not note any bogginess or any spongy feeling. Appendicitis is a common cause of acute abdominal pain. Here, I will demonstrate how to assess for McBurney point tenderness, Rovsing sign, psoas sign, and the obturator sign. Here, I palpate for the anterior superior spinous process of the ilium and traced it to the umbilicus. 2 inches from the process to the umbilicus would be the McBurney point. I then palpate the area for any tenderness or guarding.
Do you feel any sort of discomfort, sir?
Here, I will palpate for Rovsing sign and referred rebound tenderness.
Please tell me, sir, if you feel any sort of discomfort or tenderness here in the right side of your lower abdomen.
Press deeply and evenly in the left lower quadrant, then quickly withdraw your fingers.
Do you feel any discomfort?
Pain in the right lower quadrant during left-sided pressure is a positive Rovsing sign. To assess the psoas sign, I will place my hand just above the patient's right knee, and I will ask the patient to raise that thigh against my hand.
Okay, so now, sir, I will place my right hand on your right knee, and I would like you to please raise your thigh against my hand and try to resist the pressure of my hand. Okay, so please do it. Do you feel any discomfort?
Now, for an alternative method for assessing for the psoas sign.
Sir, I would like you to please turn to your left side. Lay on your left side. So please tell me if you feel any discomfort or tenderness in your abdomen.
Extension of the patient's right leg at the hip stretches the psoas
Do
muscle,
you feel anything, sir?
while flexion at the hip contracts the
What
psoas
about
muscle.
this one, sir?
Increased abdominal pain on either maneuver is a positive psoas sign, suggesting irritation of the psoas muscle by an inflamed appendix. To assess the obturator sign, flex the patient's right thigh at the hip with the knee bent and rotate the leg internally at the hip.
Any pain or discomfort, sir?
This maneuver stretches the internal obturator muscle. To assess for possible acute cholecystitis, I assess the Murphy sign. I hooked the fingers of my right hand under the costal margin at the point where the lateral border of the rectus muscle intersects with the costal margin.
Do you feel any pain or discomfort?
No.
So I would like you to take a deep breath for me, sir.
As the patient took a deep breath, this forced the liver and gallbladder down toward my fingers.
Do you feel any pain or discomfort?
No.
Ventral hernias are hernias in the abdominal wall exclusive of groin hernias. If you suspect but do not see an umbilical or incisional hernia, ask the patient to raise both head and shoulders off the bed.
Sir, please raise your head and shoulders off the bed. You may now lay down, sir. Sir, please strain down.
Occasionally, there are masses in the abdominal wall rather than inside the abdominal cavity. I asked the patient to strain down to tighten his abdominal muscles. I felt for any possible masses. A mass in the abdominal wall remains palpable. An intra-abdominal mass is obscured by muscular contraction.